Hello, my name is Helen Thomas, and I'm the Outreach Archivist for Kennesaw State University. Today I'll be talking about our project to digitize a selection from the Gregson and Ellis Architectural Drawings collection. Gregson and Ellis were an Atlanta-based architectural firm. The drawings in our collection date from the 1940s to the 1970s, and the majority are designs for buildings in the state of Georgia. However, their work also appears throughout the South and occasionally in other parts of the country. They designed a broad array of building types, including residences, schools, commercial and government buildings, medical facilities, and even special purpose buildings, like the Georgia Pavilion for the 1964 New York World's Fair. Architectural records can demonstrate not only trends in construction and design, but can also reflect the society in which the buildings exist. The drawings chosen for this project illustrate the experiences of providing and receiving medical and mental health care in the mid-20th century segregated South. Our selections included drawings from the Augusta State Hospital Complex, later named the Eugene Talmadge Memorial Hospital, the Milledgeville State Hospital Complex, later renamed Central State Hospital, Treutlen County Hospital, Ware County Hospital, Wayne County Hospital, and the Georgia Training School for Mental Defectives, which was commonly known as Gregson. These selections included hospitals of different sizes and locations, which can indicate the difference in medical care available at this time in larger cities like Augusta and smaller rural communities like Treutlen County. The drawings also demonstrate how space was used, including how segregation was built into our walls. While some of the drawings in this collection reveal separate buildings constructed for the same purpose, but each restricted to white or African American patrons, such as separate reception buildings in the Milledgeville Hospital Complex, some drawings show how individual buildings were segregated. Here you see the ground floor of the main building of the Augusta State Hospital, where you can see entrances, lobbies, waiting areas, and restrooms specifically designated to separate Black and white patrons. You can see that not only were the facilities separate, but that they clearly designed to accommodate a greater number of white patrons than Black patrons. Here is one of the inpatient units, specifically the psychiatric wing. You can see that there are 4 sections, 3 labeled white and 1 labeled colored. There are 48 beds designated for white patients and only 14 for Black patients, less than a quarter of the total number of beds. However, according to the 1950 U.S. Census Characteristics of the Population Report for the state of Georgia, African Americans made up about 30% of the population of Georgia and 40% of the population of Augusta at that time. Given that people of color have been historically undercounted by the census, the Black population could have been larger than these figures indicate. By those statistics, measuring service at either the state or local level, this hospital would have been underserving Black Georgians. Documents like these demonstrate in a very visual way how separate was never equal. In addition to separate entrances, waiting rooms, restrooms, and inpatient units, other drawings in this series show designs for separate cafeterias and pharmacies for Black and white hospital patrons, and separate locker rooms for Black and white employees. One person looking at the drawings remarked to me how 2 people entering the hospital, 1 white and 1 Black, seem as though they would have had entirely separate and different experiences receiving care. Drawings like these that offer a bird's eye view allow the reader to put themselves in the shoes of a 1950s hospital patron to better understand their whole journey. The psychiatric care facilities of the Milledgeville Hospital Complex and the Gracewood facility demonstrate how custodial mental health care functioned in Georgia at the time. These facilities are particularly significant in the study of the history of mental health care in Georgia, as they were sites of eugenic sterilization procedures, a practice which unfortunately common at the time in mental health facilities, many of which occurred in the period represented by these drawings. Finally, the drawings reflect the architectural design trends and construction methods of this period in history. These include floor plans and specifications for ductwork, plumbing, heating and cooling, and electrical wiring. They document the use of technology such as air conditioning in the mid-20th century South, design choices such as the use of Georgia marble, and construction methods of the past, including the use of asbestos. For years, the Gregson and Ellis drawings were a relatively hidden collection with minimal description available online. We now have not only a complete finding aid for the collection, but a selection of nearly 300 drawings available online. We hope that this collection will support not only our students of architecture, but also a broad array of historical inquiries. Again, my name is Helen Thomas from Kennesaw State University. Thank you very much.